I am delighted as the Chief Nursing Officer for England to be presenting this short film about how nurses, midwives and care staff can make a huge difference by leading change and adding value. Global recession and austerity has put public services under significant pressure. We do know, though, that there is a way forward as set out in the 5-year forward view. And with the right changes, the right partnerships and the right investments, we can put our health and care services onto a more sustainable footing. This understanding has led to the creation of a new framework that positions all nursing, midwifery and care staff as leaders. Firstly, it's about aligning our efforts so we use our leadership to narrow the gaps that exist in England. These are in relation to health and wellbeing, care and quality, and funding and efficiency. Secondly, in order for us to close these gaps, we need to focus on working with unwarranted variation. This helps us to understand the differences in how services are delivered and the outcomes that are achieved. Working with information is key, as is measuring, monitoring with peers and working to secure and demonstrate improvements. Thirdly, it's about measuring what matters. Evidence tells us that measuring improved outcomes, better experiences and better use of resources is the way that we can truly demonstrate the impact we have. Finally, the new framework offers 10 commitments. They can be applied at any level and by everyone, irrespective of where you work or what you do.
The unwarranted variation was that there was a minimal amount of care around asthma in Shropshire schools. Most schools didn't have a policy, a lot of schools didn't have an identified lead, a lot of schools were using out-of-date inhalers or other children's inhalers, and they didn't have a clear identified training schedule. The care of asthma wasn't where it really should be in terms of national evidence and national drivers. My role in identifying this as the lead for asthma for the Shropshire nursing team was to work in partnership with our acute trust. And part of that was to come up with an audit tool and to roll that out to the school nursing team to go into every single school in Shropshire to basically audit their care for asthma. We decided to put together a guidance for schools with a few core principles. One was that schools were to have an identified asthma lead, and it'd be the lead's responsibility to develop the training package, ensure children had a consent and a plan in place, and to be the link, if you like, between the schools and the school nursing team. So if you've got a child who's actually having... The ability to demonstrate better outcomes following the rollout of the programme that we implemented was really done in a re-audit, where we evidenced a huge increase in the amount of children who had a written consent and an asthma care plan. Just those two things alone will increase the care that young people get with asthma. Part of that audit was also going back out to parents and having some qualitative information as well. And parents were saying that actually they were now sending their children to school.
The unwarranted variation in this case was that we found that we had a really good group to support women during their pregnancy with weight management issues. But unfortunately, many of the women didn't attend that group.
But one of the things that we did was actually ask ladies that did come to the group what would engage them a little bit more within the group. And one of the things that always came up, you know, everybody always on their phones all the time, was actually Facebook.
As midwives, we realised there were these problems and we couldn't get women to attend.
Our Facebook group was the first Facebook group that was set up within the unit, and there was quite a lot of negotiations that went on.
Since the group's been set up, we've noticed there's been much better attendance. Women are aware of what the groups are about. They interact more, they talk to each other, they've got more confidence, they feel more positive about their pregnancy and the service they're getting and the extra pathway they have for their pregnancy care.
The project's very important in adding value to patient experience. The benefit of the peer support that people get from the weight management Facebook page means that they're able to build up relationships and share experiences which they've reported back to us they've found extremely helpful. I would say to other midwives and other trusts that actually, you know, this is something that is worth trying. Within the service, the maternity service, our engagement with our local population has significantly increased.
The unwarranted variation that we identified was that we weren't necessarily always getting it right in relation to delivering the right resident outcomes.
We were noting that there was inconsistency in practices, people becoming quite task orientated rather than person centred.
We put a lot of staff through training, we put a lot into our training budgets every year, and we felt that we weren't always getting the best outcomes from the staff that had gone through the training. So we were receiving things like customer complaints, we were finding that people with very complex needs were having to move into more specialised services.
We needed something that would be able to benchmark where people are now, where their knowledge and where their confidence and their skills sort of in the care practice was. The impact that we noticed with the Cognisco Dementia Key Skills was that people's confidence was rising.
Before the training, I was going into the household pretty much blind. Even though we knew each other as individuals, the way we worked, we didn't know each other's knowledge gaps.
What we've also developed is an hour sort of training session, so what we can do is tailor training to that team.
The staff themselves are feeling that they are providing better outcomes for the residents, that they feel more empowered to make decisions and to make leadership decisions. Where it's really had the most effect is where leadership's happened on a very local level and people have embraced it and they've really wanted to carry it forward and make some changes.
The problem or unwarranted variation that we were addressing was the fact that when a patient was at risk of deterioration, the wider clinical body would not be able to see that information. By introducing a single Vitals Link solution, we now have to bring one device and so that they can act immediately.
It's had a real impact on handovers. We can have a list of our patients up on the screen and we can go around and individually look at the news scores, so there's no miscommunication, it's clear.
We've been able to show that by using bedside devices, we have been able to release 600 hours of nursing time from routine documentation. That time can be used in direct patient care that supports the patient outcome, but actually supports the nurse's well-being as well.
Usually in the old system, it took me at least an hour and a half to take all my patients' vital signs. But with this system, it just takes me 30 minutes.
We are not seeing technology as something new, we're seeing it as a way to help us. I would say to any organisation that wants to replicate what we've done here at Imperial, think about the conditions of change that are needed to affect improved patient care, better experience for nurses, better outcomes for patients. Think about the leadership, think about what it is you're trying to achieve and actually bring everyone together. And what you will really do is involve nurses using technology in something that they do day in, day out.
We are committed to promoting a culture that improves population health.
I'm committed to giving individuals the best care that I can.
I'm committed to improving patient care enabled by technology.
As a midwife, I'm committed to get better outcomes for mother and baby.
The leadership potential of the workforce to manage the challenges of today and shape the future is phenomenal. And we all need to recognise our potential to do this. Everyone can influence and lead, whether in the 3,500 care homes or where 1 million patients are treated every 36 hours in the NHS. You all have such a role to play. This framework encourages us all to reach further, both as individuals and as a collective. But to do this, we need to focus on what's really important, to connect with each other and to ensure that everything we do is focused on improving care for patients, for the population, and importantly, to demonstrate the value of our professions. Thank you very much for everything that you do.